National is being accused of being misleading by picking and choosing which numbers it uses to describe the nursing shortage.
Christopher Luxon says thousands have left nursing, but official numbers show it's actually the opposite. Here's political reporter Amelia Wade.
Christopher Luxon checking the pulse of emergency care.
Everyone's beaten up post-COVID. Everyone's still really tired, getting over it, and
overwhelmed.
After yesterday releasing National's plan to wipe $4,500 off nurses' student loans each year for 5 years if they keep working in New Zealand after graduating, Luxon was especially keen to know
what's happening for you with respect to your nurses.
But what is happening with Luxon's own nurse numbers? He said in the announcement yesterday, in the last 5 years, almost 19,000 nurses have left the public health system.
I don't understand why he put those figures out.
It's the government's own number, 19,000 people. We asked how many nurses have left the public healthcare system.
National actually asked the Health Minister for the number of nurses who'd left employment regardless of whether they were re-employed. The table he got back was this one, showing since 2019, 18,670 nurses have left employment. But there was also a big caveat saying it included those who'd switched nursing jobs but stayed in the industry.
I was very clear that this didn't reflect the number of nurses leaving the system, so it's extremely disingenuous.
The Minister is focusing on that, and she now wants to couch her number and qualify the number. Fair be it, so be it. But the reality is we've had 17,000 nurses give up their nursing practice certificate since 2019.
Technically, Luxon is correct that many have given up their practicing certificates, but it is half the story, because last year the total number of nurses actually increased by 4,200 thanks to new and migrant nurses. In fact, since 2019, the number of practicing nurses has increased by almost 12,000. National was given these numbers a month ago.
You can't trust National on health. They didn't do anything to improve the position of nurses for their pay while they were in government, and now they're using misleading statistics to try beat up a scare campaign.
I don't care, you can debate numbers, but if you're debating numbers, I just say to you, you're having the wrong conversation, because that's not the conversation that's helping nurses.
Even with an increasing workforce of nurses, Aotearoa still has a crippling shortage which is burning nurses out and impacting on Kiwis' care. But National has sullied good debate about their constructive and sound policy by being misleading. Amelia Wade, News Hub.